So good morning. Hello, my name is Tony Brunning and I'm on the Lifelong Learning Project board. I have muted all the participants to avoid disruption during the webinar, but if you have a question, please write it down on the instant messaging function of Skype for Business. If you're using it on a tablet, you won't be able to have that instant messaging function. You'll be able to see the chat but not contribute to it. So if you have any questions, you can email tony.brunning@nhs.net. That's toni.brunning@nhs.net. And we'll try and answer some questions at the end of the webinar. All questions asked will be answered anonymously. No names will be given out during the webinar. Some of these will be recorded and uploaded onto YouTube and other external sites for educational purposes. If you have any further questions about this or any other issue, please contact one of the Lifelong Learning team members on lifelong@rcoa.ac.uk. So today I'm going to be showing you how to use the Logbook function of the Lifelong Learning platform. I hope you're all familiar with the landing page of the Lifelong Learning platform now, and today's webinar is going to really focus on this Logbook function. The Royal College of Anaesthetists is introducing its own lifelong learning logbook, which has been designed to be more simple and time efficient. We tried to make it as simple as possible. We wanted both trainees and consultants to have the ability to log different cases and to really accurately record how their clinical time is spent. And there will be more cases and operations and things added over time. So if there's things that you think are missing from the logbook, then please do contact us at lifelong@rcoa.ac.uk to make suggestions, because we'd like this to be able to be changed and made better. So the first thing I'm going to show you is how to log an anaesthetic case, which I'm sure most of you are familiar with doing as we stand. So if you click under Case Anaesthetic, this is more similar to logbooks that you've probably already been using. Each case has an ID. That's to allow you to either sort of refer to it or make comparisons, but also just so that when you're interrogating the logbook, each case has a unique field. You then would pop in the date, so today's date's already been pre-populated, and then you get an option of when you did it. As I'm sure you're all aware, when you make a logbook summary, one of the things of the curriculum wants to demonstrate is the sort of working pattern and time of day. So weekend working, and also whether it's done in hours, in the evening or overnight. So rather than putting in the exact time, we've made these into just 4 options. So say I was logging a case that I did this morning, I would click morning. These details here will be populated already, as long as your profile is up to date, and you can change your profile on the landing page under profile, but it will recognise which deanery you're in, which school, and which hospital. For those using the logbook who aren't in training, so the consultants and staff grades, there won't necessarily be a deanery and a school, but your hospital will be listed. And if you work in several hospitals, you're able to change it, and you can choose which one is your default hospital under your profile. So moving on to the other aspects of logbook, you can see there who the patient was. Again, we clearly state that you shouldn't put any personal patient identifiable information in this box. So if it's cases that you want to log together, so perhaps it's a certain surgeon that you work for, or it's robotic surgery or something that you want to be able to filter later, you can give it a personal reference, but this isn't mandatory. And we please do ask that you don't put in NHS numbers, hospital numbers, patients' names or date of birth, anything like that. The patient details that you do put in are simply just an age, so you can put in 37 and either in days, months or years. The ASA category for that patient, similar to what you're used to in your current logbooks. The day case question is a specific yes/no question, and this helps to accurately report the day case work, because in existing logbooks, sometimes it was difficult to record sort of day case workload. So I'm going to say this case wasn't a day case and that it was an elective list. I can choose a primary specialty. So for example, say I was in orthopedics, and then an operation, so say I did an ankle fusion. Secondary specialty, you can say yes or no. Some schools, for example, when they're recording their paediatric workload, they ask trainees to record paediatrics as the primary specialty and the secondary specialty as ENT or dental or orthopedics. And other schools just require you to list that as an orthopedic operation, and of course it will be shown that it's a paediatric case by the age of the patient. But that depends on local school guidance. Also, sometimes we do cases that involve both, say, gynecologists and general surgeons, and it will allow you to map to both specialties. The important thing here is that it will only count the case once because it's only one patient that you've anaesthetised. But if you then filter your logbook to see what orthopaedic cases you've done or what gynae cases you've done, it will, if you've listed it as 2 specialties, it will show under those cases. So for this example, I'm going to say that there wasn't a special secondary specialty and it was just an orthopedic case I was doing. And then I'm going to click the supervision. The nice thing about this is that if you click immediate or local or distant, you'll see that you get to say who supervised you. If, however, you click solo and you weren't supervised, you'll see that those options disappear. So say I was supervised in the theatre suite by another consultant, but perhaps I might have had a CT2 with me. I can say that not only was I supervised locally by a consultant, but actually I was doing some teaching as well. And again, the options there of trainees, I could be teaching other consultants, medical students or allied health professionals. So I can record exactly what is going on with every case I'm doing, both in terms of how I'm being supervised and if I'm teaching or training others. The next fields that you're presented with are similar to sort of standard logbooks that you'll be familiar with using. So you can select the mode of anaesthesia that I've been using. So in this case, say I put in an LMA, and I did perform also a regional block. So I would click yes, I've done a regional. And then as you can see, a whole new box appears, and I can select exactly what regional technique I did. So say I performed here a sciatic block, or femoral and sciatic block, perfect. I can then record the activity for this block that I performed, so whether I use the landmark technique or ultrasound. So I'll say I use ultrasound and a nerve stimulator, and if I placed a catheter I can click yes, if I didn't I can say no. So say I put in a femoral catheter and did a sciatic block, I can click yes. And again, I can then specify what supervision I had for this block. So I can say local supervision if my consultant was supervising me remotely. If there's anything specific that I want to add into notes, I can add it here. Say if I was testing different needle types or something, and I wanted to look at my own logbook later to see which ones I've used, I could put in here what type of needle I was using. If I had performed more than one block, so say I had performed another block as well, I could add another one there. But for this example, I'll leave it at just that one block. Okay, I think there's been a few difficulties with the screen freezing. Just see if I can get it to work. There's just a bit of a delay with it catching up. Okay, that's better, thank you. So if I performed any more procedures, I would click yes here, but for this example I'm going to say no, I haven't. But the type of things that you could record here is whether you did an arterial line or what type of intubation it was, any other procedures that were related to the case. But I'm going to say that I didn't for this case. The other thing that you can log if you choose to is any significant events. So say you wanted to see the incidence of laryngospasm or bronchospasm, you could click yes, you did here, and then add some notes there. And anything you added in this notes field is searchable via the logbook. So if you put laryngospasm here, then you could search your own logbook for how many cases of laryngospasm you had. I'm going to click no, there wasn't a significant event. I'm going to save this log. So as you can see there, we've ended up back at the landing page once we've logged cases. I'm not going to log any more cases under anaesthetic for the moment, and I'll just go through the other elements of Logbook. So particularly for trainees, if they want to accurately log their activity in their intensive care, then they can add intensive care sessions. Again, similar to the anaesthetic case, you have an ID, the date, you choose which time of day it was. Say this was something that I did on a night shift. Again, all of these things will be pre-populated as they are for the anaesthetic cases. Again, I have the option to add a personal reference, and I would highlight again that this shouldn't be anything that is patient identifiable. I can put in the age, so say they were 78 years. And then I can click exactly what I've done. So if I've reviewed them on the ward for a potential admission, if I've admitted them to critical care, if I've been to an arrest call or a trauma call, if I've been leading the ward round, or we've had some end-of-life discussions or discussions with relatives, I can log all those activities. But as you can see, I can also log transfers. So if I'm taking them from my intensive care unit to the CT scanner, I can log that, or likewise, if I'm taking them to a tertiary centre down the road in an ambulance, I can also log that too. So say this time I was doing a ward review of a patient, I was by myself, and I can add any notes to that I want to do, and then save the log. And this will help trainees and ACCS trainees accurately record the activity that's undertaken whilst they're in an intensive care medicine block. The acute and the chronic pain procedures are really aimed at those who are doing specialist pain trainees or who are pain consultants. We would urge trainees undertaking their pain modules, both in the core level and also the intermediate level curriculum, not necessarily to log things under acute or chronic pain, but actually they can log their pain under sessions, which I'll show you now. So again, under sessions, you have a session ID, you have the date, the time that it happens. So say I spent the afternoon in a pain clinic. Again, the hospital is already going to be pre-populated. And then I have lots of different activities that I can add under session, and I'll go through these quite slowly so you can see the types of things. Some of these are more relevant to non-training grades, so your staff grades and your consultants, and some of them are slightly more relevant to trainees. But this is obviously a logbook for all, so there'll be things there that are perhaps more or less applicable to you at various stages of your training. So say I was doing an acute pain round, I could log that. But if I was in a pain clinic, I could log that. There's other things that can be logged as an activity. So if I'm doing perioperative medicine or pre-op assessments, perhaps I'm doing a post-operative care round, or if I'm the supervising consultant for a whole theatre suite, I can log that in my own logbook. So we'll just go through those options. So you can see also there's things like clinical notes reviews or letter writing. So those particularly for kind of more remote perioperative medicine pathways where clinical notes are reviewed and then only the high-risk patients are brought in to be seen face-to-face. This activity can be logged as well. But just for this example, I'm going to log that I was in a pain clinic and that I was supervised immediately by a specialist doctor. And again, if I wanted to record any notes that were then searchable by the logbook, I could just add them here. You just save the log like so. The other thing that's particularly relevant to trainees, and more so the ACCS trainees, although everyone can benefit from this function of the logbook, that's procedures. And this is the type of thing that if you get called to another ward or department to do just a procedure that you wouldn't necessarily want to log as an anaesthetic case. So for example, you did a lumbar puncture on the ward or a chest drain in A&E resus, you could record that procedure as a standalone procedure without having to log an anaesthetic case. So you click standalone procedure, again it gets given a unique ID. I can pop the date in that I did that procedure, further highlighting that this is optional. We advocate not putting in patient identifiable information. I can see what specialty I'm in, and as you can see, these are mapped to the specialty areas from ACCS as well as pain medicine. So say I was doing an anaesthetic replacement, I did a an open chest drain. I was supervised by a senior trainee, and then I could put any details, and that will then count when you search your logbook under procedures for those procedures. So just for completeness, what I'm going to do now is show you the two pain elements of the logbook. As I said, these are really targeted at those trainees doing specialist pain and also those who are working, and this has been made in conjunction with the Faculty of Pain Medicine. So acute pain, again, there's the usual domains, so case ID, date, I select which time I did it, so say it was a morning. All of these details are pre-populated. I can then say whereabouts I completed this, so say I did this on a surgical ward who had acute pain. Again, personal reference is optional. This was a new patient that I was seeing who was 56 years and she had neuropathic pain. She was on the vascular ward. I could then say whether it was a post-op review of whether it was PCA, epidural, a general review, or acute on chronic pain. Say, for example, this was a post-operative pain review, and then I can say exactly what type of review I did. So did I give some prescribing advice, change the prescriptions, or did I do an intervention, a block perhaps, or a epidural or something to try and help with this pain. So if I click procedural intervention and then I say that I was supervised immediately because there was a consultant present on the round, and I can say that I was the predecessor and save that log. So that helps those that are doing specialist pain training to accurately log the activity that they're doing in both the acute and chronic domains. And I'll just show you the chronic pain now. Similar fields as all the other aspects of the logbook. I can say which setting it's in. So say I'm in a treatment room. This is a new patient who's 45 and he has got neuropathic pain and it's spinal pain. And I'll say that. I've been locally supervised because I'm running the clinic adjacent to my supervisor, and I can say I was the person who did the procedure. And then I could log here, say facet joint injection or anything relevant to the procedure that I've performed. And anything I type in this field is then searchable. So if I record all my facet joint injections as FJI, then I just need to search my own logbook for FJI rather than facet joint injection. Oh, I haven't completed a procedure. So if you don't complete something, an error will come up, and if you click on the error, it will take you straight to the error. So you can see here what it is I've done. So say I did a facet injection. I can save the log. So I've now demonstrated all 6 elements to the logbook. What I'll take you through now is how you can review the logbook. So if you click review logbook, you have an option to filter the logbook from certain dates. I'll just bring your attention to this box up here, which is download the full logbook. And what that does is it exports all of the files that you've created into an XLS document. So if you want to do sort of more sophisticated interrogation of your logbook, you can use this function here, and that just gives you an XLS document that you can then do what you would like to. You can also filter the logbook, so say I want to see what I've done in the last 2 months, I can choose from that date to this date. If there's anything particularly that I want to search for, like I could search for robotic surgery if I knew that in my logbook I'd recorded that as a special field, or if I was a pain doctor and I wanted to see how many facet joint injections I'd done that I'd specifically added as an extra term in my logbook, I could search for it here. But I'm going to leave that blank at the moment because I really want to filter all the logbook. Here I have a choice for just showing the anaesthetic cases. If I want to show my activity intensive care, I can filter it just for that, and likewise the acute and chronic pain. If I want to just filter by sessions and I want to filter by procedures, I can do all of that. At the moment I want to show all of the logbook, so I'm going to leave it at all. And then I click filter logbook. When I scroll down, it then gives me the things I've added for that date period. And you can see here that it's a lot of anaesthetics that I've added in those dates. If I want to, I can create a summary report of this. And this is mapped to the 2010 curriculum. So the 2010 curriculum has got a form for logbook that you need to present at your ARCPs. I'm sure most of you will have in your school some kind of Word version of this with your school's logo and perhaps the college logo, but the fields are set by the curriculum, so this should be something that's familiar to most of you. And you can see here that then it presents the data in various different ways. So you firstly get to see the total number of anaesthetics, you get to see the supervision level, how many you were directly supervised, indirectly, and how many you were teaching others. Then moving down, you can see here that by primary specialty, you get to see the supervision and also the ages of the patients. And again, secondary specialty, if that's how you want to log it. And the important thing to note here is that it doesn't double count your cases. So if you log one case as both general and gynecology, then it will show for general in the top one and gynecology in the bottom. But when it counts the total number of cases, it won't count it as 2, it will count it as 1. Then if you scroll down, you can see the time of day and level of supervision. So this allows you to present your kind of workload, mornings, afternoons, out of hours, both evenings and overnight. The priority of surgery that you're doing and how supervised you are for each of those. And then your working pattern in terms of weekdays and weekend work, as well as nighttime working. You can document your teaching experience. And here, because we've added in the fields of medical student, allied health professional, novices, other people, you can really see exactly which teaching experience you're undertaking. Then if we have a look at the modes of anaesthesia, it presents the primary mode, but also any regional techniques that you might be doing, and also presents here as well the additional procedures. So this can be reviewed online straight from the learning platform, or if you need to, you can download a summary report as a PDF. We still haven't finalised the sort of final presentation of this, so with the lifelong learning platform goes live, it will be slightly more aesthetically pleasing, but you can see here that you can create quite easily a clear logbook summary with clear dates that you filtered, what you filtered your logbook for, and then it presents all of that data in an easy to view PDF. I'm sure a lot of you are familiar with this kind of logbook summary and having to create them before your ARCPs. The new lifelong learning platform will allow people to review your logbook as you go along, so you won't be spending your time creating these every time you do a cut form, for example, because from the cut form they can review your logbook and they can see exactly what you've been doing. So we're hoping that it saves trainees lots of time without having to generate these summaries themselves. I'm going to go back to the system and I'll just show you how to review the logbook and just look at one type. So say I want to have a look at just the procedures that I've done. Again, say I choose the procedures I've done this month. I'm going to include today's date because I added some procedures for that date. I'll filter the logbook. And again here it will just show what entries I've had for that. And if you want to see the log that I've added, this will be that chest drain that I put in earlier. You can see here. And again, I can download procedural summaries, and this is particularly useful for the ACCS anaesthetic trainees who will be able to present exactly what procedures they've done, perhaps when they've been working in other specialties such as the emergency department or in acute medicine, where they won't necessarily be logging anaesthetic cases. So that's all I wanted to show you for logbook this morning. So we'll just see if there's any questions online. And I'll answer those as we go along. So we've had a question in about migration of data from old or current logbooks to the new one. Because the fields have changed and we've tried to streamline what data is recorded in the new logbook to make sure that everything is recorded is something that is reported on at the ARCP and the sort of evidence section of the curriculum. That the fields are slightly different, as I'm sure you've noticed, and so to try and import data from an existing logbook isn't going to be possible. We did this because we wanted this logbook to be a kind of clean, fresh start. So you'll have to keep a logbook summary from your current logbook before you transition over. And perhaps for some people it might be easier to transfer over, say, after their ARCP, so that they've got their logbook up to one point and then this new logbook afterwards. Okay, and we've had another question about whether it's mandatory to use this logbook. It's not mandatory, but I think you'll agree, particularly for trainees, that it's an easy way to present information. And your trainers are going to get used to being able to look at your logbook through the cut forms, and at any point your supervisor can see exactly what you've been up to. And so you might find that if you're not using it, that they're asking you to generate summaries on the current logbook that you're using. I guess the other thing to say is that this logbook is going to store all the data online for you. So if you lose your phone or you lose your tablet or something happens that you wipe it, you don't have to worry about keeping that data. And I know certainly I've had colleagues who have used other logbooks who the app support for it has finished sort of unexpectedly, and then they've had difficulties extracting their data. And also, if you don't back up your sort of more app-based logbook regularly, then there's a chance that you can lose data. So it's not mandatory, but I hope you'll agree it's easy to use. It collects data in a way that it needs to be presented. And so certainly for the new trainees starting on the platform, I think we would anticipate that most of them will use it. And I suspect the logbook use will increase as we get more familiar with the new lifelong learning platform, because it's integrated in the system. It's designed to be simple and time efficient, and it also prevents the trainees then having to create those logbook summaries just before their ARCP, which I know from my own experience can be quite a time-consuming activity. Okay, this is the end of this webinar. If you have any questions or queries, contact the Lifelong Learning team on lifelong@rcoa.ac.uk. Further webinar dates will be announced, and I hope you have a nice day.